Hello and welcome to the 111th episode by Pale Blue Thoughts. You may have heard me talk about the placebo effect a lot during my videos on debunking alternative medicines. One of the main reasons for people feeling that their illness have been cured as a result of this unscientific treatments is the placebo effect. But do you really know what this really is and why and how does this effect manifest? Many people identify placebo to be some kind of fake medicine that researchers use during the clinical trials. Well, so this video will inspect what a placebo is and what its effect is. After this, you will understand how and why people feel better after taking nonsensical treatments like homeopathy, Reiki, etc. Yes, some may find this pill a bit difficult to swallow, so there will be plenty of scientific evidence to back up the data. But first, a placebo is a sham or fake substance or treatment which is designed to have no therapeutic value. Placebo is Latin for I shall be pleasing. Common placebos include inert tablets like sugar pills, inert injections like saline, and even sham surgery. In drug testing and medical research, a placebo can be made to resemble an active medication or therapy so that it functions as a control. This is to prevent the recipient or the others from knowing with their consent whether a treatment is active or inactive, as expectations about efficacy can influence results. In a placebo-controlled clinical trial, any change in the control group is known as the placebo response, and the difference between this and the result of no treatment is the placebo effect. Researchers use placebos during studies to help them understand what effect a new drug or some new treatment might have on a particular condition. For instance, some people in a study might be given a drug to lower cholesterol. Others would get a placebo. None of the people in the study will know if they got the real treatment or the placebo. Researchers then compare the effects of the drug and the placebo on the people in the study. That way, they can determine the effectiveness of the new drug and also check for side effects. Sometimes, a person can have a response to a placebo. The response can be positive or negative. Or the person may have what appears to be side effects from the treatment. These responses are known as the placebo effect. Placebos can improve patient-reported outcomes such as pain and nausea, but this effect is unpredictable and hard to measure even in the best conducted trials. Also, contrary to popular belief, a 2008 study concluded that children seem to have greater response to placebo than adults. Homeopathic practitioners often ask this question that if all of their medicines are placebo, how does it affect children? Well, now you have the answer, sugar pill scammers. There are some conditions in which a placebo can produce results even when people know they are taking a placebo. Studies show that placebos can have an effect on conditions such as depression, pain, sleep disorders, irritable bowel syndrome, menopause, etc. In one study involving asthma, people using a placebo inhaler did no better on breathing tests than sitting and doing nothing. But when researchers asked for people's perception of how they felt, the placebo inhaler was reported as being as effective as medicine in providing relief. How the placebo is administered also has an effect on relief found in patients. Studies have found that taking more pills would strengthen the effect. Besides, capsules appear to be more influential than pills, and injections are even stronger than capsules. Even the color of the pill can make a difference. For example, a blue color placebo pill could work wonders for sleep disorders, while a red color pill is more suited for relieving pain. The mechanism of action for the placebo effect remains unknown. However, expectation is believed to play a significant role. Research on the placebo effect has focused on the relationship of the mind and the body. One of the most common theories is that the placebo effect is due to a person's expectations. If a person expects a pill to do something, then it is possible that the body's own chemistry can cause effects similar to what a medication might have caused. For instance, in one study, people were given a placebo and told it was a stimulant. After taking the pill, their pulse rate sped up, their blood pressure increased, and their reaction speeds improved. When people were given the same pill and told it was to help them get to sleep, they experienced the opposite effects. Experts also say that there is a relationship between how strongly a person expects to have results and whether or not results occur. The stronger the feeling, the more likely it is that a person will experience positive effects. There may be a profound effect due to the interaction between a patient and the healthcare provider. What really happens within involves complex neurobiological reactions that includes everything from an increase in feel-good neurotransmitters like endorphins and dopamine to greater activity in certain brain regions linked to moods, emotional reactions, and self-awareness. All of it can have therapeutic effect. Fundamentally, the placebo effect is a way for your brain to tell the body what it needs to feel better. A study published online by PLOS Biology may have identified what goes on the brain during a placebo effect. Researchers used functional MRI to scan the brains of people with chronic pain from knee osteoarthritis. Then everyone was given a placebo and had another brain scan. The researchers noticed that those who felt pain relief had greater activity in the middle frontal brain region called the gyrus, which makes up about 1/3 of the frontal lobe. In general, placebos can affect how patients perceive their condition and encourage the body's chemical process for relieving pain and a few other symptoms, but they have no impact on the disease itself. Placebos won't lower your cholesterol or shrink that tumor. Instead, placebos work on symptoms modulated by the brain, like the perception of pain. While it was once assumed that this deception was necessary for placebos to have an effect, there is now evidence that placebos can have effects even when the patient is aware that the treatment is a placebo. A study published in Science Translational Medicine explored this by testing how people reacted to migraine pain medication. One group took a migraine drug labeled with the drug's name, another took a placebo labeled placebo, and a third group took nothing. The researchers discovered that the placebo was 50% as effective as the real drug to reduce pain after a migraine attack. The researchers speculated that the driving force behind this reaction was a simple act of taking a pill. People associate the ritual of taking medicine as a positive healing effect. Even if they know it is not medicine, the action itself can stimulate the brain into thinking the body is being healed. And this is how alternate medicines ply their trade. So for the benefit of all those pseudoscience believers out there who cry out loud that there is something in their system of medicine, this is what is there, the placebo effect. Your brain tricks you into believing that you're cured. Whereas you don't have to pay anything to your brain, the alternate practitioner gets a good sum for what your brain did. You are being fooled by your own brain and the alternate healer together. Placebos may make you feel better, but they will not cure you. For that, you would need to approach evidence-based medicine. Placebos work if you are convinced that the treatment would heal you, and they work when you have an expectation that the alternate medicine would work miracles. Sadly, there are no reputed convincing studies which prove the effectiveness of any, and I mean any, alternate treatment therapies. So don't waste your time going behind those. Instead, focus on getting an illness treated scientifically. If you are watching my channel for the first time, there are two things that I want to tell you. One, that there are more than 100 videos already published on this channel on everyday science. Please take some time out to watch them by visiting the video section on the YouTube app. Secondly, please subscribe if you like to hear more scientifically established truth, for that is the only thing that would get published here on Pale Blue Thoughts. So until I come back with another scientifically valid video, this is me, Anand, saying bye-bye from Pale Blue Thoughts.